5 health checkups you should avoid after 70 that may harm you more than help. Every single year, over 45 million medical tests are performed on seniors, yet studies now show that up to 40% of them are not only unnecessary but also potentially harmful. What's worse, 99% of people over 70 have no idea that some of these routine checkups are quietly doing more harm than good. From kidney failure to bone fractures, from false alarms to needless surgeries, these tests are turning healthy seniors into lifelong patients, and it's not random. One of these checkups could increase your risk of permanent organ damage by over 65%, even if you feel perfectly fine. This isn't fear-mongering. It's real science, real studies, real lives impacted. Everything I'm about to reveal is backed by legitimate scientific studies from institutions like Harvard Medical School and the American Geriatric Society. And wait until you hear about test number 2, which is a screening that sends thousands of healthy seniors down a rabbit hole of invasive procedures every single year. Before we dive in, I have 2 questions for you. First, have you ever felt pressured to get a medical test that didn't quite feel right for your situation? Second, what's your biggest concern about medical care as you age? Please share your thoughts in the comments below as we're reading and replying to each and every comment with personalized tips and advice. Now, without any further ado, let's get started. Number 5. Bone Density Scan, DEXA. The Dual Energy X-ray Absorptiometry Scan, which is often called the DEXA scan, is marketed as the gold standard for detecting osteoporosis. It works by measuring the mineral content of your bones, especially your hips and spine, and giving you a number that determines whether you're considered normal, osteopenic, or osteoporotic. For someone in their 40s or 50s, this can be helpful in predicting future fracture risk. But after the age of 70, the benefits of this scan drop significantly, and the risks start to creep in. Here's the problem. The DEXA scan does not take into account what really matters in an older adult: balance, muscle strength, or history of falls. Seniors are more likely to break bones because of a fall, not because of a silent drop in bone density. But once a scan shows a low number, many seniors are rushed into heavy medications like bisphosphonates, which are drugs that may reduce bone loss but come with nasty side effects. These include jaw necrosis, which is a rare but horrific condition where the jawbone starts to die, and atypical femoral fractures, which are broken thigh bones that happen with no trauma at all. A massive study published in JAMA Internal Medicine found that for women over 75 who had no prior fracture and no other high-risk indicators, the DEXA scan had no significant benefit in reducing hip fractures. The number needed to screen was over 1,000 to prevent just one fracture. That's like scanning an entire senior center to help one person, while potentially harming dozens with side effects or unnecessary fear. Let me tell you about one patient. Her name was Margaret, a retired piano teacher who was 74 and lived independently. She got a DEXA scan during her annual checkup. The results came back osteopenia, which is not even a disease but a category that means slightly lower bone density. Still, her doctor immediately prescribed alendronate. 3 months later, Margaret started having jaw pain and trouble chewing. Dental x-rays showed early signs of jaw osteonecrosis. She stopped the medication and began strength training with a physical therapist instead. Today at 76, she hasn't had a single fall and feels stronger than ever. All without the medication, the better alternative. Focus on fall prevention. Simple balance training, vitamin D intake, and resistance exercises do far more to protect bones after 70 than chasing DEXA numbers. And if you think that's alarming, wait until you hear what number 4 reveals about your heart. Number 4, routine electrocardiograms without symptoms. The ECG, which is the test that records your heart's electrical signals, is a staple in many senior checkups. You lie down, electrodes are placed on your chest, and within minutes, the machine prints out a line graph that shows how your heart is beating. It sounds harmless enough, right? But the truth is, doing this test without any symptoms is a recipe for chaos. When seniors have no chest pain, no shortness of breath, and no concerning history, The chance of an ECG detecting something meaningful is incredibly low, but the chance of it detecting something misleading, that's dangerously high. Tiny abnormalities in an older person's ECG can trigger a tidal wave of follow-up tests like stress tests, echocardiograms, and even angiograms, which are invasive and carry their own set of risks. A comprehensive review in the BMJ showed that routine ECGs in low risk, as symptomatic adults over 70 often lead to false positives. These false alarms may result in unnecessary stents, medications, or even surgeries, all without improving long-term outcomes. The risk is not just physical, it's emotional and financial. Medical anxiety skyrockets after a false positive, leading seniors to feel like they're fragile or on the verge of a heart attack when they're perfectly fine. John was 77 when his insurance started covering annual ECGs. He had no chest symptoms, no dizziness, just a bit of fatigue from working on his farm. The ECG flagged something minor, and within 2 weeks he had undergone a nuclear stress test and was scheduled for an angiogram. They found nothing serious, but the procedure led to a hematoma in his leg, which took weeks to heal. He now walks with a limp and regrets ever doing that first test. So when is an ECG useful? Only when there are symptoms like chest tightness, irregular heartbeat, unexplained fatigue, or a history that raises red flags. Otherwise, you're looking at a test that could turn a healthy senior into a full-time patient. A safer alternative? Regular blood pressure checks and lifestyle changes that support cardiovascular health like walking, avoiding smoking, and managing stress. Now are you still with me? Because number 3 is one you've probably already had, and it could be messing with your kidneys more than helping them. Number 3, contrast CT scans for minor issues. The CT scan is often seen as a miracle machine. It uses X-rays to create incredibly detailed images of your body, and when doctors add contrast dye, it lights up organs and tissues like a spotlight. But here's the catch. That dye, which is called iodinated contrast, puts a huge strain on your kidneys, especially in seniors. After 70, kidney function naturally declines, even in healthy people. So pumping contrast dye into an older body can sometimes push those kidneys into injury or even failure. Contrast-induced nephropathy, which is a kind of kidney damage caused by the dye, affects about 7 to 10% of patients over 70 with reduced kidney function. A 2018 study in the American Journal of Medicine found that seniors who received contrast-enhanced scans were twice as likely to experience a measurable drop in kidney function within a week, and that drop was not always reversible. The bigger problem is why these scans are done in the first place. A senior might complain of vague abdominal pain or mild back discomfort, and the doctor orders a contrast CT to rule things out. That test often finds incidentalomas, which are small, harmless anomalies that are given scary names like mass or lesion. Suddenly, a person who had no serious issue is caught in a spiral of MRIs, biopsies, and even surgeries. The initial issue? Often just a muscle strain, gas, or a minor infection. I remember Helen, an 80-year-old widow who still taught part-time at a local library. She came in with mild pelvic discomfort. Her doctor ordered a CT with contrast just to be safe. The scan found a 1.5 centimeter lesion on her adrenal gland. It turned out to be completely benign after months of tests, but by then, the dye had already stressed her kidneys, and her creatinine levels spiked. She ended up needing 2 hospital stays to stabilize her fluids. It all started from a vague ache that would have gone away in days. So when is a contrast CT really needed? Only when the risk of a misdiagnosis outweighs the risk of kidney damage, like in suspected stroke, severe trauma, or very specific cancer evaluations. If your doctor is considering one for a minor complaint, ask about alternatives like MRI without contrast, ultrasound, or even a watch-and-wait approach with follow-up exams. Get ready, because number 2 is the most overdone, overtrusted test that could be messing with your entire hormonal system. Number 2, annual thyroid screening without symptoms. The thyroid gland, which is a small butterfly-shaped gland in your neck, controls everything from your metabolism to your energy and mood. Doctors love to test it, especially in seniors, by measuring levels of a hormone called TSH, which is thyroid-stimulating hormone. But here's the twist. After 70, your TSH naturally rises a little. That does not mean your thyroid is failing. It is just aging, like the rest of your body. Still, many seniors are misdiagnosed with subclinical hypothyroidism, which means that their TSH is a little high, but their thyroid hormone levels are still normal. Doctors often jump to prescribing levothyroxine, which is a synthetic hormone that replaces thyroid function. Sounds helpful? Well, not quite. According to a major 2017 study published in the New England Journal of Medicine, giving thyroid hormone to older adults with mildly elevated TSH had zero improvement on symptoms like fatigue, memory, or weight. Worse, it increased their risk of atrial fibrillation, which is a dangerous, irregular heartbeat. Other studies have shown that these medications can lead to osteoporosis when TSH is suppressed too far. One of the biggest problems is overreacting to the lab number. Let me introduce you to Gary, who was 73 and recently retired from his job as a postman. He felt tired, but that was likely due to years of walking 10 miles a day, not his thyroid. His doctor tested his TSH, which came back at 6.5, a perfectly normal range for someone his age. Still, he was put on thyroid meds. Within 6 months, Gary lost weight unintentionally, developed heart palpitations, and ended up in the ER. After switching doctors, he was taken off the medication and began recovering. All of that stress from one unnecessary test. The better approach? Only test the thyroid if there are strong symptoms like unexplained weight gain, chronic constipation, dry skin, or depression, especially if those symptoms are new and unusual. Otherwise, you're solving a problem that does not exist and risking real harm. And now, the final test, number 1, which almost everyone over 70 has done at least once, yet few realize the damage it can cause when misused. Number 1, colonoscopy. Colonoscopy is a life-saving tool when used at the right time. It is the gold standard for detecting colorectal cancer, which is the second leading cause of cancer deaths in seniors. But here's what many don't realize. After a certain age, routine colonoscopy, without symptoms or specific risk factors, may shift from helpful to harmful. The issue is not with the test itself, but with how, when, and why it's used. The U.S. Preventive Services Task Force recommends stopping routine colon cancer screening at age 75 for most people who have had consistently normal results. That's because the risks of the procedure, including bleeding, bowel perforation, and adverse reactions to anesthesia, increase sharply with age. A 2022 study published in Gastroenterology found that for adults over 75, the rate of serious complications from colonoscopy more than doubled, especially in those with other health conditions. Other than that, the preparation itself poses unique dangers for older adults. The powerful laxatives required for bowel cleansing can cause severe dehydration and electrolyte imbalances. For seniors with heart or kidney conditions, this can trigger arrhythmias or kidney failure. Falls during frequent nighttime bathroom trips injure thousands of elderly patients annually during colonoscopy prep. What many seniors don't hear is that if you've had multiple clean colonoscopies and no family history or new symptoms, continuing the test every 5 to 10 years may expose you to more risk than benefit. That does not mean stopping screening altogether. It means being strategic. Meet Evelyn, a 78-year-old retired baker. She had her last colonoscopy at 70, and it was completely normal. But during a routine checkup, her doctor recommended another just to be safe. She agreed. The procedure went well, but days later she developed abdominal pain. It turned out to be a microperforation, which required hospitalization and antibiotics. She recovered, but the experience shook her confidence. Looking back, her new gastroenterologist confirmed she didn't need the test again based on her spotless history. So when should seniors continue colonoscopy screening? The answer depends on individual circumstances, not arbitrary age cutoffs. If you have a personal history of colorectal cancer or advanced polyps, continued surveillance makes sense even into your 80s if you're otherwise healthy. If you've never been screened and are a vigorous 70-year-old with good life expectancy, an initial screening could be appropriate. The key is honest discussion about your overall health, life expectancy, and personal values. For many seniors, less invasive alternatives provide reasonable screening with lower risks. The FIT test, which is a simple stool test done at home annually, detects blood that might indicate cancer. While less sensitive than colonoscopy for polyps, it catches most cancers with zero procedural risk. CT colonography, sometimes called virtual colonoscopy, uses imaging instead of scope insertion, eliminating perforation risk, though still requiring bowel prep. At the end, the broader message across all these tests remains consistent. Aging changes how our bodies respond to medical interventions. What protected us in middle age might endanger us in our 70s and 80s. The wisdom lies not in avoiding all medical care, but in choosing interventions that align with our goals, values, and realistic assessment of benefits versus risks. Your doctor should be your partner in these decisions, not someone who reflexively orders tests because that's what we've always done. The courage to question, to seek alternatives, and sometimes to say no thank you might be the most powerful health intervention of all. So there you have it, the 5 checkups that may harm more than help after 70. Now we want to hear from you. How many of these have you already done, and which one surprised you the most? Share with us your experiences and opinions in the comments below. We love to hear them. I'm here to help you with health and wellness tips. Don't forget to subscribe to the channel and turn on notifications so you don't miss any important tips. Thanks for watching.